Hello. Good evening to one and all. Once again, welcome to our YouTube channel and the Nursing Life. एबटा आज आम कि मेडिकल सर्जिकल नर्सिंग मोस्ट इंपोर्टेंट क्वेश्चंस देखिबा राइट. So the last revision 30 days final post day 3 तो पहुंच जाइए हमें राइट. प्रीवियसली हमें दिन क्लास नहीं सर लेनी बेटा राइट. ये सब वीडियो भी देखी ना हो जो मैंने देखी ना हो से वीडियो सब आज मेडिकल सर्जिकल नर्सिंग रे किछि क्वेश्चंस देखिबा. So who each known as father of medicine? Who each known as father of medicine? Option is Susruta, option is Hippocrates, option is Charaka, option is Dhanvantari. So which option is the correct answer? So correct answer is option B is the correct answer. हाँ ना नहीं, option B is the correct answer. 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 ठीक. Hippocrates is the father of medicine, right? And father of surgery की बेटा father of surgery सुश्रुत, right? Father of surgery होचंती सुश्रुत. Father of surgery. Father of surgery की सुश्रुत, right? Okay. So option B is the correct answer. Next questions. Who is known as a father of surgery? Who is known as father of surgery? Option A रची Charaka, option B Susruta, option C रची Hippocrates, option D Dhanvantari. So which option is the correct answer? So correct answer is Susruta, right? Susruta is the correct answer. Option B is the correct answer. Next question देखिए बेटा. Next question रची following are the clinical features of dehydration except. Following are the clinical features of dehydration except. Option रची polyuria, option which is sunken eye, option C रची dry skin and option which is hypotension. बेटा चार्टा पांचटा शिफ्ट जेहेतु एग्जाम आउची बहुत गुड़ाए वन लाइनर क्वेश्चंस आसीबो राइट. बहुत गुड़ाए वन लाइनर क्वेश्चंस आसीबो सिंपल क्वेश्चंस आसीबो. से सिंपल क्वेश्चंस को हमको भूल ना करिवार अछि माने रखि दो राइट. सो प्रत्येक क्वेश्चंस इजी क्वेश्चंस आसीबो निहाती भाबरे राइट. मैक्सिमम क्वेश्चन इजी आसीबो. से मैक्सिमम जो इजी क्वेश्चंस को हमको भूल ना करिवार अछि करेक्टली आंसर करिवार अछि. So following are the clinical features of dehydration except. So which option is the correct answer? Polyuria, sunken eyes, dry skin, hypotension. So correct answer is polyuria, right? Polyuria is the correct answer. But sunken eyes, dry skin, hypotension, these all are the clinical features of dehydration except polyuria, right? So option A is the correct answer. Polyuria means beta excessive urine production, right? Excessive urine production. Excessive urine production. Excessive urine production, right? Next questions. All are a risk for pulmonary embolism except. All are a risk factor for pulmonary embolism except these. Option A is obesity, option B is prolonged immobilizations, option C is pregnancy, option D is amnesia. So which option is the correct answer? All are risk factor for pulmonary embolism except. Option A is obesity, option B is prolonged immobilizations, option C is pregnancy, option D is anemia. So which option is the correct answer? Which option is the correct answer? बेटा फटाफट आंसर कर देला. So correct answer is anemia, right? एनीमिया को छाड़ दिले बेटा all are the risk factor for pulmonary embolism, right? Obesity, pregnancy, prolonged immobilization, these all are the risk factor for pulmonary embolism except anemia, right? Next question. Which of the following is the earliest clinical manifestation of increased ICP following head injury? Which of the following is the earliest clinical manifestation of increased ICP following head injury? Option A is pupillary dilation. Option B is diminished level of consciousness, that is altered mental status. And option C is hemiparesis, and option D is coma. So which option is the correct answer? Yes, correct answer is diminished level of consciousness or altered mental illness, right? Option B is the correct answer, right? Option B is the correct answer, right now beta? Option B is the correct answer. Next questions. Carrier stage of HBV or hepatitis B virus is for. Option A is 3 months, option B is 6 months, option C is 9 months, and option D is lifelong. Carrier stage of HBV, it is hepatitis B virus, is for. Option is 3 months, option is 6 months, option is 9 months, option D is lifelong. So which option is the correct answer? So correct answer is beta lifelong, right? Carrier stage of hepatitis B virus is for lifelong. Option D is the correct answer. Option D is the correct answer. Option D is the correct answer, beta, right? Option D is the correct answer. Next questions. Commonest cause of blindness in India is option A is vitamin A deficiency, option B is cataract, option C is glaucoma, and option D is trachoma. So which option is the correct answer? Commonest cause of blindness in India, very important questions beta. Vitamin A deficiency habo na, cataract habo na, glaucoma habo na, trachoma habo beta. In India, commonest cause of blindness in India beta. So correct answer is cataract beta, cataract. Option B habo. Option B is the correct answer. Option B is the correct answer. Cataract habo. Right? Next questions. Question number 8 is chronic renal failure causes all. Chronic renal failure causes all except. Option is hypertension, option is hyperkalemia, option C is decreased creatinine level, option B is hypocalcemia. So which option is the correct answer? फटाफट आंसर कर दिला बेटा, फटाफट आंसर कर दिया. Chronic renal failure causes all except. Chronic renal failure causes all except. Chronic renal failure causes hypertension, है ना नहीं? Hyperkalemia and hypocalcemia, right? बट केवे भी डिक्रीज करे नहीं क्रिएटिनाइन लेवल को इंक्रीज हुए, राइट ना नहीं? सीरम यूरिया क्रिएटिनाइन सब बेले बढ़ी की थाए है ना रेनाल फेल्योर रे. तो ऑप्शन सी इज द करेक्ट आंसर. ऑप्शन सी इज द करेक्ट आंसर. क्रोनिक रेनाल फेल्योर रे ऑलवेज इंक्रीज्ड रहे बेटा लेवल सीरम यूरिया एंड क्रिएटिनाइन, सीरम यूरिया एंड सेरम क्रिएटिनाइन सब बेले इनक्रीज ठीक थाए है ना नहीं, डिक्रीज हुए ना. डिक्रीज क्रिएटिनाइन लेवल इज एक्सेप्ट ऑल आर द causes of chronic renal failure है ना नहीं. Next questions. Question number 9 is characteristic feature of Parkinsonism include option is tremor at rest, option B is rigidity, option C is hypokinesia, option D is all of the above. So which option is the correct answer beta? Revised कर दोची बेटा, right? हम मन करे कि सब questions revision है जीवो. तमने पढ़ी सारी चाहिए सब questions पुणे तेरे हमें revision कर दोची last revision within 30 days, right? So characteristic feature of Parkinsonism include option is tremor at rest, option is rigidity, option is hypokinesia, option is all of the above. So which option is the correct answer? फटाफट आंसर कर दे बेटा. Characteristic feature of Parkinsonism include all of the above, right? Tremor at rest, rigidity, hypokinesia, ये सब features तो रहे बेटा Parkinsonism रे, right? है ना नहीं? ट्रेमर एट रेस्ट, रेस्टिंग ट्रेमर्स को पिल रोलिंग भी कहते बेटा जानी था. पिल रोलिंग मध्य कहते पिल रोलिंग. ट्रेमर एट रेस्ट और रेस्ट ट्रेमर्स को कौन कहते बेटा? पिल रोलिंग, राइट? सो ऑप्शन डी इज द करेक्ट आंसर. नेक्स्ट क्वेश्चंस. बोन मैरो ट्रांसप्लांटेशन इज नॉट यूजफुल इन following condition. Bone marrow transplantation is not useful in following condition. Option A is thalassemia, option B is leukemia, option C is pernicious anemia, option D is aplastic anemia. So correct answer is pernicious anemia, right? Correct answer is pernicious anemia. Pernicious anemia कौन पे होची बेटा? विटामिन B12 माल एब्जॉर्प्शन जोगु है ना नहीं. विटामिन B12 माल एब्जॉर्प्शन जोगु होची, and this is not useful in bone marrow transplantation, right? Vitamin B12 माल एब्जॉर्प्शन जोगु malabsorption जोगु pernicious anemia हेते है ना नहीं. एंड याकू विटामिन B12 इंजेक्शन माध्यम रे हमें मैनेज करि परिबा, राइट? बोन मैरो ट्रांसप्लांटेशन माध्यम रे मैनेज करि हबनी. याकू कोन करा हबो बेटा? विटामिन B12 इंजेक्शंस माध्यम रे हमें याकू मैनेज करिबा. विटामिन B12 इंजेक्शन माध्यम रे मैनेज करि हबो, राइट? विटामिन B12 इंजेक्शन माध्यम रे हमें मैनेज करि परिबा, है ना नहीं? मैनेज्ड विथ विटामिन B12 इंजेक्शंस, है ना नहीं? जेहेतु विटामिन B12 माल एब्जॉर्प्शन जोगु पर्निशियस एनीमिया होची. बाकी सब बेटा थैलेसेमिया, ल्यूकेमिया, राइट, एनाप्लास्टिक एनीमिया, ए सब हमें बोन मेरो ट्रांसप्लांटेशन माध्यम रे हमें ताको करेक्शन करि परिबा, है ना नहीं? तार जेनेटिक ब्लड डिसऑर्डर को करेक्ट करि परिबा थ्रू बोन मैरो ट्रांसप्लांटेशन. थैलेसेमिया, ल्यूकेमिया, एप्लास्टिक एनीमिया, these are the genetic blood disorder, है ना नहीं? Next questions. Viral and fungal infections are prevented by infections are prevented by option is neutrophils, option B is basophils, and option C is T lymphocytes, and option D is B lymphocytes. So which option is the correct answer? Viral and fungal infections are prevented by. Viral and fungal infections are prevented by. Option A is neutrophils, option B is basophils, and option C is T lymphocyte, and option B is B lymphocytes. So which option is the correct answer? So correct answer is T lymphocytes, right? Viral and fungal infections are prevented by T lymphocytes, right? And T lymphocytes are responsible for cell mediated immunity. मन रखता बेटा क्वेश्चंस आते, right? Cell mediated immunity की कहले बेटा T lymphocytes, right? And B lymphocyte is responsible for humoral immunity. मन रखता क्वेश्चंस आउचे हैला. T lymphocytes is responsible for what? Cell mediated immunity. मन रखता बेटा, cell mediated immunity. Questions are responsible for cell mediated immunity or humoral immunity. Questions पचारुचे बेटा, T lymphocytes or B lymphocytes. So B lymphocyte is responsible for what? Humoral immunity. Responsible for humoral immunity, right? Humoral immunity, right? Against bacteria and toxins, right? B lymphocytes are responsible for humoral immunity against bacteria and toxins, है ना नहीं? And T lymphocytes are responsible for cell mediated immunity, and this is defending against pathogens like viruses and fungi. है ना नहीं? Viruses and fungi by T lymphocytes, right? Viruses and fungi by T lymphocytes, and B lymphocytes bacteria and toxin by bacteria and toxins by, right? मन रखिता. So option C is the correct answer. Viral and fungal infections are prevented by T lymphocytes. Next questions. Question number 12 is most useful test for detection of early renal dysfunction is. Most useful test for detection of early renal dysfunction is. Option A is serum urea, option B is serum creatinine, option C is creatinine clearance, option D is GFR, glomerular filtration rate. So which option is the correct answer beta? Most useful test for detection of early renal dysfunction is. Option A is serum urea, option B is serum creatinine, option C is creatinine clearance, and option D is GFR. So which option is the correct answer? So correct answer is which option beta? Which option is the correct answer? So correct answer is creatinine clearance. Option C is the correct answer. Creatinine clearance is the correct answer, right? Early renal dysfunction by most useful test la creatinine clearance, right? Option C is the correct answer. Next questions. Most sensitive marker of body iron storage. Most sensitive marker of body iron storage. Option A is serum iron. Option B is serum ferritin. Option C is serum transferrin. Option D is serum total iron binding capacity. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर कर दिया. Most sensitive marker of body iron store. बेटा जो मैंने पर्यंत वीडियो को लाइक करना, वीडियो को लाइक कर दियो, शेयर कर दियो, एवं जो मैंने चैनल को फर्स्ट टाइम देखछन या तो चैनल को सब्सक्राइब मध्य कर दियो, राइट? Please subscribe the channel, like the video, and share the video to your best friend and to your colleagues. Right? So which option is the correct answer? Most sensitive marker of body iron store is serum ferritin. Serum ferritin is the correct answer. Option B is the correct answer. But option B is the correct answer. Right? Option B about most sensitive marker of body iron store is serum ferritin. Serum ferritin. And this is the primary protein that store iron inside the cells, right? And ये कौन करछि बेटा directly correlate with total body iron storage को जाना पड़ुछि बेटा. ए टेस्ट माध्यम रे हमें जानी पारिबा हन न केते बॉडी रे केते आयरन स्टोर होछि जाना पड़िजो, राइट? So option B is the correct answer. Next questions. Question number 14. Best test for liver dysfunction is best test for liver dysfunction is option is serum albumin, option B is serum bilirubin, option C is SGPT, and option D is prothrombin time. So which option is the correct answer? Best test for liver dysfunction is best test for liver dysfunction is option A is serum albumin, option B is serum bilirubin, option C is SGPT, and option D is prothrombin time. So which option is the correct answer? Best test for liver dysfunction is best test for liver dysfunction is best test for liver dysfunction is which option is the correct answer? कौन होगा correct answer? Serum albumin, serum bilirubin, SGPT, prothrombin time. So which option is the correct answer? So correct answer is prothrombin time, right? PTINR, prothrombin time, right? PTINR देखो चाहिए ना नहीं prothrombin time, PT और INR. And PT is the best acute test for synthetic liver dysfunction or liver failure, right? So option D is the correct answer, right? Option D is the correct answer, beta. Following are the sign of oliguric phase of ARF, acute renal failure, except following are the sign of oliguric phase of acute renal failure, except option A is hyperkalemia, option B is elevated BUN, option C is increased GFR or increased glomerular filtration rate, and option D is fluid overload. So which option is the correct answer? बेटा को ऑप्शन करेक्ट हबो, को ऑप्शन करेक्ट हबो. सो करेक्ट ऑप्शन हबो इंक्रीज ग्लोमेरुलर फिल्ट्रेशन रेट. ऑप्शन सी इज द करेक्ट आंसर. ऑप्शन सी इज द करेक्ट आंसर, राइट. नेक्स्ट क्वेश्चन जदि हम देखिबा कोन अछि बेटा मोस्ट इंपोर्टेंट फैक्टर इन वुंड हीलिंग. मोस्ट इंपोर्टेंट फैक्टर इन वुंड हीलिंग बेस वेरी वेरी इंपोर्टेंट, बहुत इंपोर्टेंट क्वेश्चंस बेटा. मोस्ट इंपोर्टेंट फैक्टर एंड इन वुंड हीलिंग इज most important factor in wound healing is option रचे hematoma formation, option B रचे migration of WBC, option C रचे collagen deposition, and option D रचे none of these. So which option is the correct answer? Most important factor in wound healing is correct answer is collagen depositions. Option C is the correct answer. Collagen deposition is the correct answer, right? Collagen deposition is the करेक्ट आंसर. फटाफट आंसर करो. कोलाजन डिपोजिशन इज द करेक्ट आंसर ना बेटा. नेक्स्ट क्वेश्चन देखिबा. नेक्स्ट क्वेश्चन आंसर कर दियो बेटा. व्हिच ऑप्शन इज द करेक्ट आंसर? व्हिच ऑप्शन इज द करेक्ट आंसर? फटाफट आंसर कर दियो. Pernicious anemia occurs due to deficiency of option A is vitamin B1, option B is vitamin C, option C is vitamin B12, and option D is all. So which option is the correct answer? So vitamin B1 deficiency रे कौन हुए बेटा? very very रोग हुए, right? Vitamin B1 that is thiamine. Vitamin B1 को कौन कहा जाए? thiamine कहा जाए, हाँ ना नहीं? thiamine deficiency और vitamin B1 deficiency रे कौन हुए? बेरी बेरी रोग हुए बेटा. बेरी 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 माने रखा बेटा. ये सब क्वेश्चंस विटामिन डेफिशिएंसी डिसऑर्डर और विटामिन डेफिशिएंसी डिजीज निहाती भाव में आसीबा बेटा राइट बेरी और आउ कौन अच्छी बेटा विटामिन B1 डेफिशिएंसी आउ कौन हुए वर्निक्स कोर्साकॉफ सिंड्रोम हुए वर्निक्स कोर्साकॉफ सिंड्रोम वर्निक्स कोर्साकॉफ सिंड्रोम हुए विटामिन B1 डेफिशिएंसी रे कोर्साकॉफ राइट वर्निक्स कोर्साकॉफ सिंड्रोम है ना थायामिन डेफिशिएंसी रे हुए विटामिन सी डेफिशिएंसी रे कौन हुए स्कर्वी हुए है ना नहीं विटामिन सी डेफिशिएंसी रे स्कर्वी हुए है ना नहीं एंड विटामिन B12 डेफिशिएंसी रे पर्निशियस एनीमिया हुए राइट सो ऑप्शन सी इज द करेक्ट आंसर ऑप्शन सी इज द करेक्ट आंसर राइट ऑप्शन सी इज द करेक्ट आंसर विटामिन B12 डेफिशिएंसी पर्निशियस एनीमिया होची राइट नेक्स्ट क्वेश्चन नंबर 18 all are autosomal recessive disease except all are autosomal recessive disease except option A रची Marfan syndrome option B रची phenylketonuria option C रची sickle cell anemia option D रची Wilson disease so which option is the correct answer all are autosomal recessive disease except Wilson disease, this is autosomal recessive disease, right? Sickle cell disease, this is also autosomal recessive disease. Phenylketonuria, this is also autosomal recessive disease, right? Except Marfan syndrome, right? Option A is the correct answer. Except Marfan syndrome, all are the autosomal recessive disease, right? Phenylketonuria, Wilson disease, sickle cell anemia, these all are the recessive, autosomal recessive inheritance disease, right? And Marfan syndrome, it autosomal dominant, not autosomal recessive, right? Marfan syndrome, it is autosomal dominant, autosomal dominant. Marfan syndrome is autosomal dominant disease, right? But phenylketonuria is the autosomal recessive disease, sickle cell anemia is the autosomal recessive disease, and Wilson disease also autosomal recessive disease, right? Next questions. In acute myocardial infarctions, which enzyme rage fast? Coenzyme first body thai beta. Option A CPKMB. Option A CPKMB, option B SGPT, option C SGOT, and option D troponin T. So बेटा ऑप्शन ए CPKMB केते घंटा भितर रेज होता है बेटा 4 to 6 आवर भितर बढ़ी था इन मायोकार्डियल इन्फेक्शंस राइट 4 to 6 आवर भितर बढ़ी था राइट SGPT mainly it is specific to कौन बेटा and this is a liver enzyme ना बेटा ना liver dysfunction से ले liver dysfunction से ले body था right liver dysfunction से ले and this is the liver enzyme है ना liver enzyme cardiac enzyme no so SGPT and SGOT, this is the liver enzyme, right? Liver enzyme, not cardiac enzyme. है ना नहीं? So option D रहे troponin I. So troponin I and troponin T, troponin I and troponin T. कितने घंटा भीतर it begins to elevate within 3 to 4 hours. Within 3 to 4 hours ana nahi so coenzyme first elevate hela tahale troponin T and troponin I se pen trop I trop T ame test korche ana nahi myocardial infarction case re so option D is the correct answer right and troponin enzyme reach earliest and remains elevated with the longest periods, the longest time there, right? Next questions. Question number 20. Most serious complication of fracture of bone is option is fat embolism, option is hemorrhage, option is septicemia, option is hypertension. So which option is the correct answer? Which option is the correct answer? Most serious complication of fracture of bone is option is fat embolism, option is hemorrhage, option is septicemia, option is hypertension. So which option is the correct answer? Which option is the correct answer beta? Most serious complication of fracture of bone is option A is fat embolism, option B is hemorrhage, option C is septicemia, option D is hypertension. So which option is the correct answer beta? फटाफट आंसर कर दो मोस्ट सीरियस कॉम्प्लिकेशन ऑफ फ्रैक्चर ऑफ बोन इज so correct answer is fat embolism right fat embolism is the correct answer fat embolism haba beta right fat embolism right option A is the correct answer very good Divyaranjan Behera Anita Mahanti Priyanka Shuna very good fat embolism is the correct answer बहुत बढ़िया बबीता अनिता बहुत बढ़िया प्रदीप तगोड़ा बहुत बढ़िया बेटा ऑप्शन ए इज द करेक्ट आंसर संजना हरपल रश्मि रेखा महाराणा ऑप्शन ए इज द करेक्ट आंसर बहुत बढ़िया गुड आंसर नेक्स्ट क्वेश्चंस most common site of carcinoma pancreas is most common site of carcinoma pancreas is option A is head option B is body option C is tail option D is none of the above so which option is the correct answer most common site of carcinoma pancreas is option A is head option B is body option C is tail option D is none of the above so which option is the correct answer फटाफट आंसर कर देला which option is the correct answer बेटा most common site of carcinoma pancreas is head body tail and none of the above so co option correct habo beta so correct answer is head habo beta option A is the correct answer so 60 to 70% बेटा जाने था 60 to 70% of pancreatic cancers occurs in the head of the pancreas right 60 to 70% of pancreatic cancer occurs in the head of the pancreas occurs in the head of the pancreas right so option A is the correct answer right next question which of the following is not a autoimmune disease which of the following is not a autoimmune disease option A is SLE option B is rheumatoid arthritis option C is syphilis option D is sclerosis so which option is the correct answer Shakuntala Pradhan good evening so which option is the correct answer फटाफट आंसर कर देला बेटा which of the following is not a autoimmune disease which of the following is not a autoimmune disease which option is the correct answer फटाफट आंसर कर दिया option A is SLE option B is rheumatoid arthritis option B C is syphilis option D is sclerosis So which option is the correct answer? So correct answer is syphilis. Very good, Divyaranjan Behera. Then Anita Mahanti, Rashmi Rekha Maharana. Very good, beta. Babita Shakuntala Badhan. Option C is the correct answer, right? So syphilis is not an autoimmune disease, right? This is a sexually transmitted infection, STI. This is a STI, STI, sexually transmitted infections, STI, and caused by syphilis caused कहा द्वारा होची बेटा causative organisms of syphilis treponema pallidum, right? Treponema pallidum, treponema pallidum, treponema pallidum is the causative organisms of syphilis, है ना नहीं? And this is not an autoimmune disease. Next questions. But all are the example of autoimmune disease. Rheumatoid arthritis, SLE, sclerosis. These all are the autoimmune disease, right? Next questions. Question number 23. Most common cause of meningitis in age group 6 months to 2 years. Most common cause of meningitis in age group 6 months to 2 years. Option A रचे meningococci, option B रचे pneumococci, option C रचे human influenza, option D रचे Escherichia coli, E. coli. So which option is the correct answer? को option correct होगा बेटा. Most common cause of meningitis in age group 6 months to 2 years. फटाफट आंसर कर दिला, फटाफट आंसर कर दिला बेटा, फटाफट. So correct answer is H. influenza or human influenza, right? So option C is the correct answer, right? Option C is the correct answer, beta, human influenza. Hemophilus influenza. Hemophilus influenza, right? Hemophilus influenza. Sorry, beta. Hemophilus influenza type B. Hemophilus influenza type B. Type B, wala, right? Type B. The most common cause of meningitis in age group 6 months to 2 years, right? And meningococci and pneumococci, most common cause of meningitis in older children, adults and adults patient, haba beta, right? This meningococci and pneumococci in adult patients and older children, bada pila manankare hochi beta, right? So option C is the correct answer, Hemophilus influenza type B, right? Next question. Most common cause of meningitis in age group 2 years to 20 years. Most common cause of meningitis in age group 2 years to 20 years, right? Option A is pneumococci, option B is Neisseria meningococci, and option C is Hemophilus influenza, and option D is E. coli. So which option is the correct answer? So correct answer is option B is the correct answer, right? Option B is the correct answer. Most common cause of meningitis age group 2 years to 20 years. 2 years to 20 years है beta. Neisseria meningococci है beta, right? This is the most frequent cause of bacterial meningitis. This is the bacterial meningitis in children over 2 years, adults and young adults, right? So option B is the correct answer. Option B is the correct answer beta, right? माने रखता बेटा. देखो इतने अच्छी बेटा 6 months to 2 years रा पिला मन को meningitis होची बेटा. Most common cause of meningitis किए बेटा Hemophilus influenza type B, right? And 2 years to 20 years means above 2 years रा पिला मन को और 2 years रा above age group पिला मन को कौन होची बेटा Neisseria meningococci होची माने रखी था. Next questions. Question number 25. Which of the following drug is used for dilation of pupil in children? Very, very important questions. Which of the following drug is used for dilation of pupil in children? Option is atropine, option is tropicamide, option C is dexamethasone, option is indomethacin. So which option is the correct answer? फटाफट आंसर कर दे बेटा. So correct answer is कौन होगा बेटा? Atropine. Atropine is the correct answer. Option A. Atropine. Babita atropine. Shakuntala Badhan. Option A. Very good. Atropine is the correct answer. Option A is the correct answer. Atropine is the correct answer. Right? Pupillary dilation by key responsible atropine drugs. Right? Atropine drug is used for dilation of pupil in children. Right? And tropicamide कौन पे यूज करा जाउची? This is used in children. Atropine and tropicamides used in adults. Used in adults. And dexamethasone and indomethacin is the NSAIDs groups of drug. Right? Non-steroidal anti-inflammatory drugs. Steroidal and non-steroidal anti-inflammatory drugs होचंती dexamethasone and indomethacin, right? Steroidal and non-steroidal anti-inflammatory drugs, right? Dexamethasone and indomethacin, right? Okay, tropicamide used for eye examination and in adults ना बेटा. Tropicamide use कराओ जी in adults ना. But atropine drug कौन करची used for the dilation of pupil in children, है ना नहीं? Next questions. Most common cause of aortic aneurysm is. Most common cause of aortic aneurysm is. Option is trauma, option is Marfan syndrome, option is atherosclerosis, option is syphilis. So which option is the correct answer? Which option is the correct answer? Most common cause of aortic aneurysm is. Most common cause of aortic aneurysm is atherosclerosis. Option C is the correct answer, right? Next questions. In AIDS patient, pneumonia occurs due to option A is Staphylococcus, option B is Streptococcus, option C is Pneumocystis carinii, option D is Mycoplasma. So which option is the correct answer? In AIDS patient, pneumonia occurs due to Pneumocystis carinii, and this is nowadays this is known as Pneumocystis girovesi, right? एबे कौन कहा जाउची बेटा याकू? Pneumocystis girovesi, right? So option C is the correct answer. In AIDS patients, pneumonia occurs due to Pneumocystis carinii, right? And this is the opportunistic fungal infections in HIV patients or HIV AIDS patients when CD4 count stops. This is the opportunistic fungal infection, and hallmark of opportunistic fungal infection in HIV AIDS patients. Opportunistic fungal infection, right? In AIDS patients. Next questions. Weight gain occurs in all except. Option is hypothyroidism, option which is steroid therapy, option is Cushing syndrome, option D is pheochromocytoma. So which option is the correct answer? ऑप्शन ए रचे hypothyroidism, option which is steroid therapy, option which is Cushing syndrome, option which is pheochromocytoma. So which option is the correct answer beta? So correct answer is option D, pheochromocytoma is the correct answer, right? Weight gain occurs in all except steroid therapy रे weight gain होची, Cushing syndrome रे weight gain होची, hypothyroidism रे weight gain होची, except pheochromocytoma रे weight gain हो नहीं. कौन हुए? weight loss हुए. कौन हुए बेटा? pheochromocytoma रे weight loss हुए, right? weight loss हबो हाँ ना नहीं. आउ कौन हुए? आउ कौन हुए? heart rate बढ़ी जाए, heart rate increased थाए बेटा, heart rate increased रहिबो. sweating हबो, right? sweating मध्य हबो. These all are the clinical manifestation of pheochromocytoma, right? Next questions. Brick-bone fever is very important questions. Brick-bone fever is option is typhoid fever, option B is malignant fever, option C is malaria, option D is dengue fever. So which option is the correct answer? फटाफट आंसर करो. Brick-bone fever, brick-bone fever. अरे यार आंसर कर दिया फटाफट भाई, जो मैंने भी देखू छो. Very good. Dengue fever is the correct answer, right? Brick-bone fever is dengue fever, right? Next questions. Causative organisms of diarrhea in AIDS patients. Causative organisms of diarrhea in AIDS patient is option which is rotavirus, option which is E. coli, option C which is Cryptosporidium, option which is Streptococcus aureus. So which option is the correct answer? Very important questions. Causative organisms of diarrhea in AIDS patient is 5-star questions beta, most important questions for your upcoming examinations. Causative organisms of diarrhea in AIDS patient is so correct answer is which option? So Cryptosporidium is the correct answer. Cryptosporidium is the correct answer. Option C is the correct answer, right? Sakuntala Pradhan, Sanjana Harpal, option C, Madan Panda, option C. Very good. Option C is the correct answer. Beta, option C is the correct answer. Next questions. Which of the following is the most important nursing care for an unconscious patient? Option A to maintain adequate circulation. Option B to maintain patent airway. Option C to maintain proper breathing pattern. Option D to provide skin care. So which option is the correct answer? Which of the following is the most important nursing care for unconscious patient? Very good, बहुत बढ़िया. To maintain patent airway is the correct answer. Very good, बहुत बढ़िया. Option B is the correct answer. Sakuntala Pradhan, Sanjana Harpal, Rashmi Rekha Maharana, Madan Panda, Ramya Sucharita. Beta option B है. To maintain patent airway, right? Pradipta Gowda, Dibyaranjan Behera. Option B एक है बेटा Madan Panda, right? Very good. Option B is the correct answer, right? Madan Panda. You are right. Next questions. Complication of massive blood transfusion is option which is hyperkalemia, option which is AR embolism, option C which is thrombocytopenia, option which is all of the above. So which option is the correct answer? Which option is the correct answer? Beta, complications of massive blood transfusion. Very important questions for your upcoming OSSC nursing officers exam. 5-star questions beta. Complication of massive blood transfusion is कौन होगा बेटा? बेसी स्पीड रे ब्लड ट्रांसफ्यूज जदि करबा पेशेंट को ताहले कौन हबो? एयर एम्बोलिज्म भी हबो, हाइपरकैलेमिया भी हबो, thrombocytopenia भी हबो, right? So all of the above is the correct answer. Option D is the correct answer. Option D is the correct answer, right? Option D is the correct answer, right? Very good, बहुत बढ़िया. शकुंतला प्रधान, प्रदीप्ता गौड़, दिव्य रंजन बेहेरा, मदन पंडा, सागरिका जैना, Rasmireka. Right. Very good. Next questions. Question number 33. Priority nursing diagnosis in a patient with pneumonia will be option A alter mucous membrane, option B impair gas exchange, option C alter nutrition less than body requirement, option D activity intolerance. So which option is the correct answer? फटाफट आंसर कर दिया, फटाफट आंसर कर दिया. Priority nursing diagnosis in a patient with pneumonia will be. So correct answer is impaired gas exchange, right? Impaired gas exchange is the correct answer. हाँ ना नहीं? Next questions. Amubeg is used when? Amubeg is used when? Option patient develop respiratory arrest. Option patient develop renal failure. Option patient develop hepatic failure. Option patient develop severe hypertension. को समय आमे Amubeg को यूज करूचे. रेस्पिरेटरी आरएस समय आम यूज करछे हां ना. ऑप्शन ए इज द करेक्ट आंसर. रेनल फेल्योर नहीं कि हेपाटिक फेल्योर नहीं कि सीवियर हाइपरटेंशन रे आम यूज करनो. Patient develop a respiratory arrest, then we used this Amubeg, right? Next questions. Meaning of abbreviation PRNH. Meaning of abbreviations PRNH. Option A at bedtime. Option B give only once in a day. Option C when required. Option D if necessary in emergency. So which option is the correct answer बेटा? फटाफट आंसर कर लो. At bedtime कौन कहूचे बेटा? HS है ना. At bedtime कौन कहूचे हमें HS. Give only once in a day कौन कहूचे हमें OD कहूचे. OD कहूचे give only once in a day है ना. Then when required this is PRN है ना. PRN when required. If necessary in emergency कौन कहूचे बेटा? If necessary in emergency. SOS है ना. If necessary in emergency SOS. So which option is the correct answer? So option C is the correct answer. है ना. Option C is the correct answer. Next question. Question number 36. If a patient with pharyngitis caused by group A streptococci is not treated by proper antibiotic medications, it may result in. If a patient with pharyngitis caused by group A streptococci is not treated by proper antibiotic medication, it may result in option whooping cough, option peptic ulcers, option glomerulonephritis, option nephrotic syndrome. So which option is the correct answer? So correct answer is option C. Very good. Option C is the correct answer. Glomerulonephritis is the correct answer. If a patient with pharyngitis caused by group A streptococci is not treated by proper antibiotic medication, it may result in glomerulonephritis, right? Next questions. Excessive urination at night is stormage. Very important 5-star MCQ, right? ये सब क्वेश्चंस आसीबो बेटा तम मानकर एग्जामिनेशन रे एक्सेसिव यूरिनेशन एट नाइट इज टर्म एज ऑप्शन ए रे मिक्चुरेशंस ऑप्शन बी रे नॉक्चुरिया ऑप्शन सी रे dysuria and option D रे pyrrhia. So which option is the correct answer? Which option is the correct answer? Pyrrhia means कौन बेटा? Presence of pus in the urine or presence of white blood cells in the urine, that is pyrrhia, right? Presence of pus in the urine or presence of oh, WBC in the urine, right? That is pyrrhia. Nocturia कौन है बेटा? राति रे परिस्रा हो रहा, नाइट टाइम रे urinate करबड़ा, frequently urinate at night, frequently urinate at night, frequently urinate at night, है ना नहीं? That is nocturia. And dysuria is the painful urinations, है ना नहीं? Painful urination. हाँ तो हाँ कि नहीं? And micturations is the urinations, है ना नहीं? Or passing urine is the micturations. Excessive frequency urination at night, right? The micturations, right. Excessive frequency urination at night, that is the nocturia, right? And micturations का ना बेटा urination or passing urine, right? Urinations or passing urine is known as micturations, हाँ ना नहीं? तो हमारा correct answer कौन होगा? Excessive urination at night is termed as option B is the correct answer, nocturia, right? Excessive urination at night is termed as nocturia, or frequently urinate at night is the nocturia. Next question. T-tube drainage is used after the following surgical procedure. Option A रे अच्छी बेटा mastectomy, option B रे cholecystectomy, option C रे lobectomy, option D रे colostomy. So which option is the correct answer? फटाफट आंसर कर देला. Which option is the correct answer? T-tube. Mastectomy कौन है बेटा? Surgical removal of infected mustard air cells behind the ear, है ना नहीं? That is mastectomy. Okay ना? T-tube यूज हवा की? T-tube यूज हवा नहीं? Cholecystectomy कौन? Surgical removal of the gallbladder, है ना नहीं? Surgical removal of the gallbladder. So एथिरे यूज होची कौन? T-tube drainage. Lobectomy कौन बेटा? Removal of one lobe of an organ, है ना नहीं? Lobectomy कोथिरे करा होची बेटा? lungs रे करा होची, thyroid रे करा होची, है ना नहीं? lung lobe और thyroid lobe को हमें जदी remove करचे, surgical removal of one lobe of an organ, that is lobectomy. Colostomy कौन बेटा? Colostomy, what is colostomy? Surgical opening of the colon and to the abdominal wall or stoma, है ना नहीं? So which option is the correct answer? हमारा correct answer कौन होगा? Correct answer is option B, cholecystectomy is the correct answer, right? Option B is the correct answer. Next questions. अच्छी बेटा, a patient with laryngitis is treated symptomatically for 2 weeks, but he is still experiencing hoarseness Persistent hoarseness may be associated with hoarseness of voices in laryngitis. So कौन हेथि पारे बेटा ऑप्शन रचे ब्रोंकाइटिस ऑप्शन बी रचे एम्फाइसेमा ऑप्शन सी रचे pneumothorax, right? And option D is laryngeal cancer. So which option is the correct answer? So correct answer is laryngeal cancer beta. A hoarseness of voices means beta laryngeal cancer. हाँ ना नहीं laryngeal cancer माने रखी था laryngeal cancer रेखा. Right? Option D is the correct answer. Next questions. To give intramuscular injection, which size of needle is used? Very very important question. To give intramuscular injection, which size of needle is used? को gauge रा needle use करबा को पड़िबा intramuscular injections पाई. Option A रचे 18 to 20 gauge, option B रचे 22 to 23 gauge, option C रचे 25 to 27 gauge, and option D रचे 5 to 7 gauge needle. So which option is the correct answer? So correct answer is option B is the correct answer. Option B correct था. But option B is the correct answer ना 22 रु 23 गज रा needle आमे यूज करूचे intramuscular injections पाई आना नहीं 22 रु 23 gauge needle को यूज करूचे एवं 25 रु 27 gauge needle आमे intradermal injections and subcutaneous injections पाई आमे 22 से 25 रु 27 gauge रा needle यूज करूचे for intradermal injections intradermal injections or subcutaneous injections पाए subcutaneous injections पाए माने रखे था बेटा subcutaneous injections पाए 25 रु 27 गज रा needle यूज करचे for intradermal injections पाए और subcutaneous injections पाई माने रखी था right. So very very important questions for your upcoming OSSC nursing officer recruitment exam 2026, right? Next questions. Question number 41. Commonest type of fracture seen in children is very very important questions. Commonest type of fracture seen in children is Colles fracture. Option A अछि Colles fracture. Option B Potts fracture. Option C रचे green stick fracture and option D रचे pathological fracture. So which option is the correct answer? Very very important 5-star questions beta from your medical surgical nursing paper. The very very important questions. Commonest type of fracture seen in children is green stick fracture. Option C is the correct answer. Green stick fracture. Very good. बहुत बढ़िया समस्त को जाना वेरी गुड बेटा बहुत बढ़िया ग्रीन स्टिक फ्रैक्चर इज द करेक्ट आंसर. नेक्स्ट क्वेश्चन. व्हिच ऑफ द फॉलोइंग इज कॉम्प्लिकेशन ऑफ सिरोसिस? व्हिच ऑफ द फॉलोइंग इज कॉम्प्लिकेशन ऑफ सिरोसिस? ऑप्शन रचे पोर्टल हाइपरटेंशन, ऑप्शन रचे एसाइटिस, ऑप्शन सी रचे हेपाटिक एन्सेफेलोपैथी, ऑप्शन रचे ऑल ऑफ द अबव. सो व्हिच ऑप्शन इज द करेक्ट आंसर? व्हिच ऑफ द फॉलोइंग इज कॉम्प्लिकेशंस ऑफ सिरोसिस? So correct answer is all of the above, right? All of the above, right? Complications of cirrhosis, ascites, hepatic encephalopathy, portal hypertension, right? All of the above is the correct answer, right? Option D is the correct answer. But next questions. The most important assessment for the nurse make for a patient having severe allergic reactions. The most important assessment for the nurse to make for a patient having severe allergic reactions is option is skin color, option B is urine output, option C is pupillary response, option D is blood pressure. So which option is the correct answer? फटाफट आंसर कर देना. जाने बेटा समस्ते स्किन कलर करियो बोली. ऑप्शन डी हबा बेटा राइट. Option D is the correct answer. Very good, Rasmi Rekha Maharana. Option D, Babita. Option D. So blood pressure, however, right? Due to anaphylaxis or due to severe allergic reactions, कौन हबो बेटा? Vasodilation हबो, right? Vasodilation हबो and hypotension हबो, right? Hypotension हबो patient को blood pressure. Important assessment is blood pressure बेटा, right? patient कौन हबो? Vasodilation हबो allergic reaction जोगो vasodilation हबो आना नहीं. So vasodilation हेबा जोगो कौन होची blood pressure रो कौन हबो फॉल हबो बेटा hypotension हबो hypotension, right? hypotension हबो, right? So option D is the correct answer. Option A हबो नहीं बेटा skin color हबो नहीं, right? Option D is the correct answer. Blood pressure drops हबो, right? And circulatory collapse हबो ना बेटा due to allergic reactions. Circulations collapse हबो. Next questions. Fluid balance in our body is maintained chiefly by. Fluid balance in our body is maintained chiefly by. Option A is kidney, option B is skin, option C is lungs, option D is heart. So which option is the correct answer? Fluid balance in our body is maintained chiefly by. ये बेटा very good, option A is the correct. Babita, Bina Rani Jana, Pradipta Goda, Divyaranjan Behera, Jyoti Manjari. Very good. Option A is the correct answer. Kidney is the correct answer. Next questions. Most appropriate treatment for a patient with emphysema is. Option A Fowler's positions. Option B postural drainage. Option C diuretic drug. Option D passive breathing exercise. कौन होगा आंसर? Most appropriate treatment for a patient with emphysema is. Option A Fowler's positions, option B postural drainage, option C diuretic drug, option D passive breathing exercise. So which option is the correct answer? फटाफट आंसर कर दिया बेटा. Most appropriate treatment for a patient with emphysema. So correct answer कौन होगा बेटा? Correct answer is postural drainage है ना नहीं? Postural drainage हबा. तो चेस्ट ट्यूब दबा को पड़ेगा, चेस्ट ट्यूब दबा को पड़ेगा पेशेंट को इन एम्फाइसेमा केस रे, हाँ ना नहीं? प्लूरल कैविटी रे कौन होची बेटा? पस थाउची, हाँ ना नहीं? ताको हमको ड्रेन करबार अछि इंसेशन ऑफ चेस्ट ट्यूब माध्यम रे, हाँ ना नहीं? सो ऑप्शन बी इज द करेक्ट आंसर. पोस्चरल ड्रेनेज माध्यम रे आमे ट्रीटमेंट करबा. एप्रोप्रिएट ट्रीटमेंट पोस्चरल ड्रेनेज देके एंटीबायोटिक थेरेपी देके आमे पेशेंट को मैनेज करबा, हाँ ना नहीं? एम्फाइसेमा केस रे. नेक्स्ट क्वेश्चंस. Question number 46. Under normal physiological condition, the respiratory center is stimulated by option A oxygen, option B lactic acid, option C carbon dioxide, and option D calcium ion. So which option is the correct answer? So which option is the correct answer? फटाफट आंसर कर दिया बेटा. Under normal physiological condition, the respiratory center is stimulated by oxygen, lactic acid, carbon dioxide, calcium ions. So चारिटा ऑप्शन को ऑप्शन करेक्ट होगा बेटा. which option is the correct answer? Which option is the correct answer? So correct answer is carbon dioxide is the correct answer. Carbon dioxide is the correct answer, right? Option C is the correct answer. Next question. In following which is not a predisposing factor for larynx cancer, laryngeal cancer. In following which is not a predisposing factor for larynx cancer. Option A poor personal hygiene, air pollutions, heavy alcohol ingestions. Option D chronic respiratory infections. Option A poor personal hygiene, option B air pollutions, option C heavy alcohol ingestion, option D chronic respiration infections. So which option is the correct answer? Which option is the correct answer? Very good. Poor personal hygiene. Option A is the correct answer. Poor personal hygiene jogu larynx cancer हबार maximum chance रहुची बेटा, right? Sorry, this is not a predisposing factor, right? So poor personal hygiene is not a predisposing factor for larynx cancer, but otherwise air pollutions, heavy alcohol ingestions, chronic respiratory infections jogo larynx cancer hochi, right? So poor personal hygiene is not a predisposing factor for larynx cancer, right? Option A is the correct answer, right beta? Next questions. In following which is the most common site of liver abscess? In following which is the most common site of liver abscess? Option is right lobe of liver, option which is left lobe of liver, option is both lobes, option is none of these. So which option is the correct answer? In following which is the most common site of liver abscess? So correct answer is right lobe of liver, right? Option A is the correct answer. Because in right lobe of liver receive larger volume of blood flow. Ananai. So option A is the correct answer beta. Next questions. Meaning of chain strokes respiration is. Meaning of chain strokes respiration is. Option A periods of tachypnea alternating with periods of apnea. Option B periods of hyperapnea alternating with periods of apnea. Option C an increase in both rate and depth of respiration. Option D deep regular and sagging respirations. So which option is the correct answer? Meaning of chain strokes respiration. Meaning of chain strokes respirations is the periods of hyperapnea alternating with periods of apnea. So option B is the correct answer. Option B is the correct answer beta. Option B is the correct answer. Option B have a correct answer, right? Option B is the correct answer. Next questions. Most common clinical feature of pleurisy is. Most common clinical feature of pleurisy is. Option A is sharp stabbing pain when breathing. Option B is productive cough. Option C is cyanotic nail beds. Option D is tachycardia. Very most important MCQ. Most common clinical feature of pleurisy is. So correct answer is sharp stabbing pain when breathing. Sharp stabbing pain when breathing, right? So option A is the correct answer. But option A is the correct answer. Next questions. The most reliable way to assess the respiratory status of a patient is. Option A is observe the chest rising and falling. Option B is listen and feel the air movement. Option B is observe the color of sclera. Option B is none of the above. So which option is the correct answer? Which option is the correct answer? फटाफट आंसर कर दिया बेटा, फटाफट आंसर करो. A patient who the most reliable way to assess the respiratory status of a patient is. So which option is the correct answer? Most reliable way to assess the respiratory status of a patient. Option A is observe the chest rising and falling. Option which is listen and feel the air movement. Option C is observe the color of sclera, and option which is none of the above. So correct answer is listen and feel the air movement. Option B is the correct answer. Right now, next question, beta. A patient who is experiencing dyspnea should be placed in. Option A orthopenic positions. Option B supine position. Option C left lateral position, and option D lithotomy positions. A patient who is experiencing dyspnea should be placed in. So dyspnea patient को हमें को positions देवा बेटा, को positions देवा, फटाफट आंसर कर दिया. Orthopenic positions, right? Option A is the correct answer. Orthopenic positions or sitting upright positions, हाँ ना नहीं? Option A is the correct answer. Next questions. The sensor of pulse oximeter can be applied to the all following body parts except one. The sensor of pulse oximeter can be applied to the all of the following body parts except one. कोटा को छाड़ी की सब जगह में पल्स ऑक्सीमीटर हमें लगे पारुचे एंड ऑक्सीजन सैचुरेशन जानी पारुचे. ऑप्शन ए रची ईयरलोब रे लगा हुए हाँ ना नहीं लगा हुए, फिंगर रे मध्य लगा हुए, थंब एंड टो रे भी लगा हुए, लिप रे लगा हुए नहीं, राइट लिप रे लगा हुए नहीं. सो ऑप्शन सी इज द करेक्ट आंसर एक्सेप्ट वन देछि. सो ये लिप को छाड़ी दिले ऑल आर द फॉलोइंग बॉडी पार्ट्स वी एप्लाइड टू द पल्स ऑक्सीमीटर हाँ ना नहीं पल्स ऑक्सीमीटर को हमें अप्लाई करि पारछे ऑक्सीजन सैचुरेशन जानिबा पाए. नेक्स्ट क्वेश्चंस. Which of the following is early warning sign for the cancer of the lung? Which of the following is early warning sign for the cancer of the lung? Option रचे dysphagia, option B रचे persistent cough, option C रचे unusual bleeding, option D रचे aphasia. So which option is the correct answer, beta? Which option is the correct answer? Which of the following is early warning sign for the cancer of the lung? Dysphagia, persistent cough, unusual bleeding, as aphasia. So which option is the correct answer? The correct answer is persistent cough. Option B is the correct answer. This is the warning sign for the cancer of the lung. Persistent cough is early warning sign for the cancer of the lung. Right? Next questions. Projectile vomiting is the feature of very most important MCQ beta. Projectile vomiting is the feature of option A duodenal atresia, option B pyloric stenosis, option C congenital megacolon, option D appendicitis. Already questions asked sarchi beta. So correct answer is pyloric stenosis re beta projectile vomiting features देखिए को मिले, right? Pyloric stenosis. Non-bilious projectile vomiting after feeding. Non-bilious projectile vomiting after feeding. This is the clinical features of pyloric stenosis, right? So option B is the correct answer. Next questions. The ABG or atrial blood gases values of a patient deteriorates. The nurse should first assess the patient for option which is cyanosis, option B bradycardia, option C restlessness and mental confusion, option D no need of any assessment because the patient is normal. So which option is the correct answer? So which option is the correct answer? Right, correct answer is because restlessness and mental confusion is the correct answer, right? Restlessness and mental confusion means beta hypercapnia haba, right? ଯଦି deteriorate करूची ABG value for the patients कौन हवा बेटा hypoxia हवा, hypoxia होची patient को, right? And hypercapnia होची means CO2 बढ़ुची CO2 retention होची hypercapnia, right? Restlessness हवा, anxiety हवा, confusion हवा, cyanosis हवा, हाँ ना नहीं? ये सब पर धीरे धीरे हवा बेटा प्रेजेंट रहिबा. So first is the nurse should assess a patient for restlessness and mental confusion, right? Option C is the correct answer. Next questions. Question number 57. Diabetes mellitus is usually identified by people. Option A albuminuria, option B glycosuria, option C loss of appetite, and option D hematuria. So which option is the correct answer? Diabetes mellitus is usually identified by people by option A albuminuria, option B glycosuria, option C loss of appetite, and option D hematuria. So correct answer कौन होगा बेटा? Correct answer is glycosuria. So option B is the correct answer, glycosuria. ग्लूकोज लेवल कौन हबा बेटा, बॉडी बहाना नहीं, when glucose level exceed around 180 milligram per deciliter है ना, बॉडी बा ग्लूकोज इन यूरिन है ना नहीं, आम देखा को पाइबा ग्लूकोज in the urine पाइबा और ग्लाइकोसूरिया को ग्लूकोज इन द यूरिन, दैट इज ग्लाइकोसूरिया है ना नहीं. So glucose level, when blood glucose level exceeds or increased in the urine, ताले निहाती भावरे आमे जानिबा कि पेशेंट्स को कौन होचे ग्लाइकोसूरिया होचे बोली, राइट. So option B is the correct answer, right. So glucose level exceeds from 180 milligram per deciliter जदि बढ़ुचे increased ए ब्लड ग्लूकोज लेवल को आम जदि पाउचे ग्लूकोज लेवल 180 मिलीग्राम पर डेसिलिटर इन द यूरिन जदि पाउचे बेटा ताहले पेशेंट को ग्लाइकोसूरिया होचे बोले आम जानिबा, राइट. Next questions. Absence of identifiable QRS complex in ECG given indication of option which is sinus arrhythmia, option which is atrial fibrillation, option which is ventricular fibrillation, and option which is none of the above. So which option is the correct answer? Which option is the correct answer, beta? Absence of identifiable QRS complex in ECG given indication of ventricular fibrillations, right. So option C is the correct answer. Next questions. In a patient with a fracture of long bone, in a patient with fracture of long bone, patient कौन है ची long bone fracture है ची, so which is the most serious complications? So serious complication कौन हमारा chances अस्सी patient को, option है ची AR embolism, option है ची fat embolism, option है ची infections, option है ची bleeding. So which option is the correct answer? Which option is the correct answer, beta? So correct answer is fat embolism, है ना नहीं. Option B is the correct answer, fat embolism हवा. Next question. When a patient continues to hypoventilate, what complications may occur? When a patient continues to ventilate, what complication may occur? So which option is the correct answer? Sorry. OSSC you are option is metabolic acidosis, option B is respiratory acidosis, option C is metabolic alkalosis, option A is respiratory alkalosis. When a patient continues to ventilate, what complication may occur? So correct answer is better respiratory acidosis, right. Option B is the correct answer. Hypoventilation or hypoventilation से कौन हुए बेटा respiratory acidosis हुए, कौन पे कार्बन डाइऑक्साइड रिटेंशन सब सी पे, राइट. कार्बन ड्यू टू कार्बन डाइऑक्साइड रिटेंशंस, राइट. कार्बन डाइऑक्साइड रिटेंशन जोगो हाइपोवेंटिलेशन होची है ना नहीं. एंड या जो कौन हबा बेटा ब्लड पीएच कमी जीव है ना नहीं. कार्बनिक एसिड एंड ब्लड पीएच कमी जीव लोअर साइड को पळेबो तो रेस्पिरेटरी कौन हबा रेस्पिरेटरी एसिडोसिस हबा. नेक्स्ट क्वेश्चंस. एग्जामिनेशन ऑफ पेशेंट विथ द हेल्प ऑफ stethoscope is termed H. Examination of patient with help of stethoscope is termed H. Option A रची palpation, option B रची percussion, option C रची auscultation, and option D रची percussor. So which option is the correct answer? So correct answer is auscultation. ए सब questions भी आसी सारी आसी बबी बेटा, right? एमती simple questions भी पचारी पड़े. So examination of a patient with the help of stethoscope is termed H. Auscultation है ना नहीं, auscultation. So listening to the internal body sounds with the help of stethoscope or using stethoscope रे आमे कौन कहूचे ताको auscultation कहूचे हाँ ना नहीं, listening of internal sound by using stethoscope, listening of internal sound by using stethoscope है ना नहीं, ताको हम कौन कहूचे auscultation कहूचे, right? So option C is the correct answer. Next question, oral thrust each A. Option A છે bacterial disease, option B છે viral disease, option C છે protozoal disease, and option D છે fungal disease. So which option is the correct answer? Oral thrust each A, bacterial disease, option A છે bacterial disease, option B છે viral disease, option C છે protozoal disease, option D છે fungal disease. So which option is the correct answer? So correct answer is beta, or oral thrust is a fungal disease, and it is caused by Candida albicans. Right? Candida albicans. Right? Next questions. Most common complication of chronic asthma. Chronic asthma. Option A is atelectasis, option B is emphysema, option C is pneumothorax, option D is pulmonary fibrosis. So which option is the correct answer, beta? Most common complication of chronic asthma is, very good, option B is the correct answer, emphysema. Next question, the common factor of puerperal sepsis. The most common factor of puerperal sepsis: scarlet fever, otitis media, bacterial endocarditis, rheumatic fever, and glomerulonephritis. Is that all? Option A rachi all are protozoal disease. Option B rachi result from streptococcal infections that enter via the upper respiratory tract. Option C rachi all are caused by Staphylococcus aureus. Option D rachi all are fungal disease. So which option is the correct answer? The most common factor of puerperal sepsis: scarlet fever, otitis media, bacterial endocarditis, rheumatic fever, and glomerulonephritis. Is that all? So correct answer is which option, beta? Correct answer is which option? Correct answer is option B, right? Result from streptococcal infection that enter via the upper respiratory tract, right? So option B is the correct answer, right? Next questions. To facilitate maximum air exchange, a patient should be placed in the option A rachi supine positions, right? Option A rachi supine positions, option B rachi orthopenic positions, option C rachi high Fowler's position, option D rachi semi Fowler's position. So which option is the correct answer? To facilitate maximum air exchange, a patient should be placed in the orthopenic positions, right? Orthopenic positions. So option B is the correct answer. Option B is the correct answer. हाँ ना नहीं? Option B is the correct answer. But option B is the correct answer. Orthopenic positions, but orthopenic position is the correct answer. Next question. A patient with dyspnea should be placed in. A patient with dyspnea should be placed in. Option A is Sims positions. Option B is supine position. Option C is orthopenic position, and option D is lithotomy positions. A patient with dyspnea should be placed in. So correct answer is orthopenic positions, beta. Correct answer is orthopenic positions, right? Next questions. Clear liquid diet include all the following except. Clear liquid diet include all the following except. Option A is tea or coffee. Option B is apple juice. Option C is gelatin. Option C is milk pudding. So which option is the correct answer? But a high faller position and orthopenic position dita jaga jodi deyithiba nahi ki jodi orthopenic position dey nathiba tahale high fowlers position tame choose kari pariba. Otherwise orthopenic positions and high fowlers dita jaga position deyithiba nahi ki first ye correct haba, right? काहे ना maximize होची थोड़ा से capacity and via forward leaning जेते बेले patient upright position रे होची and forward leaning होची नहीं कि maximum air exchange हे पारि orthopenic positions रे, right? So orthopenic position पर high fowlers positions हबा, right? So दीटा जगह थिले तमे orthopenic positions रे correct करि पारिबो, right? High fowlers positions also correct, but इथिरे ना maximum air exchange हबा बेटा, right? So option B is the correct answer. माने रखितो हैं भूल करिबनी. So a clear liquid diet include all the following except option A is tea or coffee, option B is apple juice, option C is gelatin, option D is milk pudding. So which option is the correct answer? So correct answer is beta option D, milk pudding is the correct answer, right? Milk pudding is the correct answer. Contain dairy and solids and making it a fluid, liquid or soft food item coach beta, right? Rather than a translation clear liquid, right? So except milk pudding, all are the clear liquid diet, right? Apple juice, gelatin, tea or coffee, these all are the clear liquid diet. Next questions. Following are the first line medication for TB except. All of the following are the first line medications for TB except isoniazid, ये होची TB medication, anti-tubercular drugs, ethambutol also anti-tubercular drugs, and rifampicin also anti-tubercular drugs except cycloserine. Except cycloserine. This is the first. These all are the first line medications, but cycloserine is the second line anti-tuberculosis drug, right? Cycloserine is the second line anti-tubercular drugs, right? Isoniazid, ethambutol, rifampicin, pyrazinamides दिया होची है ना, and pyrazinamides also दिया होची first line medication for TB रे है ना, and pyrazinamide दिया जाची pyrazinamide है ना. कौन दिया होची isoniazid, ethambutol, rifampicin and pyrazinamide. These all are the first line medication for TB है ना. Next questions. Question number 69. Which of the following is used to remove wax from the ear canal? Option A mineral oils, Option B is cotton swab applicator. Option C is warm normal saline irrigation. Option D is none of these. So which option is the correct answer? Which of the following is used to remove the wax from the ear canal? Which of the following is used to remove the wax from the ear canal? Option is mineral wells. Option is cotton swab applicator. Option C is warm normal saline irrigation. Option D is none of these. So which option is the correct answer? So correct answer is mineral wells. Mineral wells. Mineral wells used to remove the wax from the ear canal, right? Question number 17. Main clinical symptoms of hiatal hernia. Main clinical symptoms of hiatal hernia. Option A is heartburn. Option B is vomiting. Option C is pain inguinal area. Option D is burning micturition. So which option is the correct answer, beta? Main clinical symptoms of hiatal hernia. So correct answer is heartburn. Heartburn is the correct answer. Option A is the correct answer. Heartburn or pyrosis. Pyrosis. Right? Heartburn or pyrosis caused by gastric acid reflux through the incompetent lower esophageal sphincter into the esophagus. Ananai. So option A is the correct answer. Option A is the correct answer. Beta option A is the correct answer. Heartburn ne kaha par, right? Next questions. Following cataract surgery of a patient, the nurse should option A teach the patient coughing and breathing techniques. Option B advise the patient to avoid vigorous brushing of teeth and hair. Option C both A and B, and option none of the above. So which option is the correct answer? Following cataract surgery of a patient, the nurse should advise the patient to avoid vigorous brushing of teeth and hair. Right? So option B is the correct answer. So to teach patient coughing, deep breathing exercise, breathing coughing kale increase habo ICP. So एटा हमें ए technique use करिवार नहीं, right? ICP body by intraocular pressure body by intracranial pressures body by, right? Coughing करले. So coughing को हमें avoided करता हो cataract surgery patients रे, हाँ ना नहीं? So option B is the correct answer. Option A incorrect however beta. Next questions. Question number 72. Which of the following is a complication associated with tracheostomy tube? Option A is damage the laryngeal nerve. Option B is pulmonary edema. Option C is rheumatic heart disease. Option D is tuberculosis. So which option is the correct answer? Which of the following is a complication associated with tracheostomy tube? Option A is damage to the laryngeal nerve. Option B is pulmonary edema. Option C is rheumatic heart disease. Option D is tuberculosis. So correct answer is damage to the laryngeal nerve. Option A is the correct answer. है ना नहीं? Next question. A patient is experiencing diarrhea as a side effect of chemotherapy. A patient is experiencing diarrhea and it is as a side effect of chemotherapy. Which of the following nursing diagnosis has highest priority? Which of the following nursing diagnosis has highest priority? Option A impaired skin integrity. Option B body image disturbance. Option C activity intolerance. Option D fluid volume deficit. कौन हम बेटा करेक्ट आंसर कौन हम फ्लूइड वॉल्यूम डेफिसिट हम है ना नहीं फ्लूइड वॉल्यूम डेफिसिट हम पेशेंट को जेहेतु डायरिया हो and as a side effect of chemotherapy. So nursing diagnosis has highest priority is fluid volume deficit. Option is the correct answer. Option D is the correct answer. हाँ ना नहीं डायरिया जो कौन हम इलेक्ट्रोलाइट इम्बालांस हम हाँ ना नहीं एंड हाइपोवोलेमिक शॉक को जीवार चांस अच्छी सो हमारा नर्सिंग डायग्नोसिस एज हाईएस्ट प्रायोरिटी कौन हम fluid volume deficit हम right. So next questions, which drug is used in inflammatory disease of the eye? Which drug is used in inflammatory disease of the eye? Option A रचे acetazolamide, option B रचे atropine, option C रचे cortisone, option D रचे pilocarpine. So which option is the correct answer? Option A रचे acetazolamide, option B रचे atropine, option C रचे cortisone, option D रचे pilocarpine. So which option is the correct answer? So correct answer is cortisone or corticosteroid drops हमें यूज करते हैं ना cortisone और corticosteroid drops यूज करते हैं ना option C is the correct answer. Main clinical symptoms of open angle glaucoma is option A अच्छी बेटा constant blurred vision, option A अच्छी constant blurred vision, option B अच्छी impairment of peripheral vision, option C अच्छी a sudden complete loss of vision, option D अच्छी sudden attacks of acute pain. So which option is the correct answer? The main clinical symptoms of open angle glaucoma is, so correct answer is impairment of peripheral vision. Option B is the correct answer. Main clinical symptoms of open angle glaucoma is impairment of peripheral vision, right? Impairment of peripheral vision. Next questions. Which of the following is a clinical feature of chronic open angle glaucoma? Option A is eye pain, option B is color light passes, option C is decreasing peripheral vision, option D is all of the above. Which of the following is a clinical feature of chronic open angle glaucoma? कौन होगा बेटा? Peripheral vision loss हुए बेटा, right? Peripheral vision loss होगा, right? So option C is the correct answer. Decreasing peripheral vision, right? Which of the following is a clinical feature of chronic open angle glaucoma? कौन होगा बेटा? Peripheral vision loss or decreasing peripheral vision, right? Option C is the correct answer. Next questions. Which of the following is a commonest symptoms of cataract? Commonest symptom of cataract. Very important questions. A questions आशीष सारे बेटा, right? A questions medical surgical nursing A questions आशीष सारे. Which of the following is the commonest symptoms of cataract? Option A is halos and rainbow around light. Option B is blurred and hazy vision. Option C is eye pain and irritation that worsens at night. Option D is none of the above. So which option is the correct answer? फटाफट आंसर कर दो बेटा. Which option is the correct answer? Which option is the correct answer? So correct answer is blurred and hazy vision. Very good. Option B is the correct answer. Sasmita Maji. Option B is the correct answer. Blurred and hazy vision. Option B is the correct answer, right? Blurred and hazy vision haba. Blurred and hazy vision is the commonest symptoms of cataract. Next. Progressive clouding देखा जीवा बेटा. Blurred and hazy vision हवा आना नहीं. Painless progressive clouding ऐसे बेटा clouding जिससे आना नहीं. Clouding, blurring, clouding ये सब symptoms देखा जाए को उतरे कैटरैक्ट रे हाँ ना नहीं एंड विजन लॉस भी हवा धीरे धीरे, राइट? नेक्स्ट क्वेश्चंस. व्हिच ऑफ द फॉलोइंग इज नॉट ए रिस्क फैक्टर फॉर हियरिंग लॉस? व्हिच ऑफ द फॉलोइंग इज नॉट ए रिस्क फैक्टर फॉर हियरिंग लॉस? ऑप्शन इज रिपीटेड क्रॉनिक ईयर इन्फेक्शंस, ऑप्शन बी इज एक्सपोजर टू हाई इंटेंसिटी साउंड वेव्स, ऑप्शन सी इज प्रीनेटल rubella infections. Option D taking antibiotic medication. So which option is the correct answer? Which of the following is not a risk factor for hearing loss? Which of the following is not a risk factor for hearing loss? Option A repeated chronic ear infections. Option B exposure to a high intensity sound waves. Option C prenatal rubella infections. Option D taking antibiotic medicines. So which option is the correct answer, beta? So correct answer is taking antibiotic medicines, right? Option D is the correct answer. So taking antibiotic medicine not a risk factor for hearing loss, है ना नहीं? So option D is the correct answer. Next questions. Most common site of cancer among female. Very important questions. Most common site of cancer among female. Option A vagina, option B uterine cervix, option C uterine body, option C fallopian tube. Most common site of cancer among female is. So correct answer is uterine cervix. Option B is the correct answer. Option B is the correct answer. Very good, Shakuntala, Rojaline, Jyoti Manjari, Anita, Madan Panda. Very good. Option B is the correct answer. Uterine cervix. Right. And most common site of cancer among male कौन बेटा? Most common site of cancer in men or male. Lung cancer, हाँ ना नहीं? Male most common site of cancer among male each oral cancer, right? Oral cancer in India. Oral cancer in India. Worldwide कौन बेटा? Worldwide is lung cancer. Lung cancer is worldwide. बस बट बहुत गुड़ाए एग्जामिनेशन रे बेटा हमारा नर्सिंग एग्जामिनेशन रे कौन देता है बेटा? प्रोस्टेट कैंसर देते हैं, ओरल कैंसर और कौन देते हैं? प्रोस्टेट कैंसर, है ना नहीं? प्रोस्टेट कैंसर मैंने एग्जामिनेशन से प्रोस्टेट कैंसर दौच है ना? प्रोस्टेट कैंसर और ओरल कैंसर. प्रोस्टेट कैंसर ठीक है हाई इकोनॉमिक कंट्री रे प्रोस्टेट कैंसर ही था बेटा, राइट? बुझी पाला? हाई इकोनॉमिक कंट्री रे, बट लो इकोनॉमिक कंट्री हमर इंडिया एतिके बड़ा इकोनॉमिक कंट्री नुह सी पे ओरल कैंसर इन इंडिया, राइट? So most common site of cancer among male is oral cancer, right? In India and worldwide lung cancers, right? And this is the most important questions, beta. This is the most important questions. माने रखे था. 5 stars question. The most common site of cancer among female is uterine cervix, and most common site of cancer among male is oral cancer, in India and worldwide lung cancer, right? Next questions. Which drug is not used in Meniere's disease? Option A glucocorticoids, option B antihistamines, option C antiemetics, option D diuretics. So which option is the correct answer? Which drug is not used in Meniere's disease? Which drug is not used in Meniere's disease? Option A glucocorticoid, option which antihistamines, option C antiemetics, option D diuretics. So which option is the correct answer, beta? कौन है correct answer? Worldwide breast cancer. Okay, worldwide breast cancer. Globally breast cancer, right? But most common female cancer is cervical cancer, better, right? Cervical cancer. से cervical cancer को prevent करवा पाए बहुत गुडे vaccination नौचंती girls माने, right? Cervical cancer अब first हो जाए. Second common is cervix. Okay. So which drug is not used in Meniere's disease? Option A glucocorticoids. So glucocorticoids is the correct answer, right? Glucocorticoids is the correct answer, right? So glucocorticoids is not used in Meniere's disease. Option A is the correct answer, right? Next questions. In following which is a side effect of nitroglycerin? In following which is a side effect of nitroglycerin? Option A vomiting, option B diarrhea, option C headache, option D constipations. In following which is a side effect of nitroglycerin? Option A vomiting, option B diarrhea, option C headache, option D constipations. Side effect of nitroglycerin, headache, right? Headache is the side effect of nitroglycerin, right? Next questions. Administrations of medications in the eye is known as, option A inoctions, option B instillations, option C insufflation, option D insertion. So which option is the correct answer, beta? So correct answer is instillations, right? Administration of medication in the eye is known as instillations. So option B is the correct answer. Next questions. Chronic open angle glaucoma may cause. Chronic open angle glaucoma may cause. Option A chronic eye inflammation, option B detachment of the retina, option C increase intraocular pressure, option D decrease blood flow to the retina. So which option is the correct answer? So correct answer is beta increased intraocular pressure, increased IOP, increased intraocular pressure, right? Chronic open glaucoma may cause increased intraocular pressure, IOP. Next questions. Which is the preferred position for a patient undergoing thoracentesis? Which is the preferred position for a patient undergoing thoracentesis? So thoracentesis patient को हमें को position देखी procedure करीबा. So option A supine, option B prone, option C sitting, option C left lateral. So which option is the correct answer? So correct answer is sitting positions, right? Sitting positions. Next questions. Which is the best time to take sputum specimen? Very, very important questions for your upcoming examinations. Which is the best time to take sputum specimen? Option A after awakening in morning. Option B before bedtime. Option C after having lunch. Option D in between lunch and dinner. So which option is the correct answer? Which is the best time to take sputum specimen? Which is the best time to take sputum specimen? So correct answer is after awakening in morning. Option A is the correct answer. Option A is the correct answer. Next questions. Which of the following surgery is performed for chronic otitis media? Which of the following surgery is performed for chronic otitis media? Option A mastectomy. Option B tympanectomy. Option C tympanoplasty, and option D ossiculoplasty. So which option is the correct answer? टिम्पानोप्लास्टी हबा ना मास्टेरेक्टोमी हबा बेटा को? टिम्पेनेक्टोमी हबनी कि ऑसिकुलोप्लास्टी हबनी? ये मास्टेरेक्टोमी हबा ना टिम्पानोप्लास्टी हबा को? फटाफट आंसर कर दियो. व्हिच ऑप्शन इज द करेक्ट आंसर? So correct answer is tympanoplasty, right? Option C is the correct answer, tympanoplasty, right? Next questions. After cataract surgery, a patient complains of nausea. Which is the best nursing interventions? After cataract surgery, a patient complains of nausea. Which is the best nursing interventions? Option A advise patients to take rest. Option B notify the doctor. Option C administer prescribed antiemetic. Option D no need of any interventions. Or after cataract surgery, a patient complains of nausea. Which is the best nursing interventions? So prescribed and antiemetics, right? Administer prescribed antiemetics. So option C is the correct answer. Next questions. Temperature of the water to be used in tepid sponging should be. Temperature of the water to be used in tepid sponging should be. Option A 80 Fahrenheit to 95 Fahrenheit. Option B 105 Fahrenheit to 115 Fahrenheit. Option C 20 Fahrenheit to 30 Fahrenheit. And option D 10 Fahrenheit to 20 Fahrenheit. So which option is the correct answer? फटाफट आंसर कर दे बेटा. सो करेक्ट आंसर कौन हबा? करेक्ट आंसर इज ऑप्शन ए इज द करेक्ट आंसर. करेक्ट आंसर इज ऑप्शन ए इज द करेक्ट आंसर, राइट? ऑप्शन ए इज द correct answer. Option A is the correct answer. But 80 to 95 Fahrenheit. This is the temperature used in tepid sponging. Very important questions beta. Very important questions. Tepid sponging ପାଇଁ କେତେ डिग्री टेम्परेचर ଆମେ यूज କରୁଛୁ? Temperature of the water 80 Fahrenheit to 95 for tepid sponging, right? Or lukewarm water. Next questions. Which of the following is a risk factor for colorectal cancer? Which of the following is a risk factor for colorectal cancer? Option A diet high in calcium. Option B diet low in vitamin C. Option C multiple sex partner. Option D a high fat and low fiber diet. So correct answer is a high fat and low fiber diet. This is a risk factor for colorectal cancer. High fat and low fiber diet. This is the risk factor for colorectal cancer, right? So option D is the correct answer. Next question. Tinnitus is a. Tinnitus is a. Option A subjective symptoms. Option B objective symptoms. Option C prodromal symptoms. Option D functional. So which option is the correct answer beta? Patient जोटा कहबो सेटा कोन बेटा? That is the subjective symptoms. आना नहीं? ना ऑब्जेक्टिव सिम्टम्स कौन हबो बेटा ऑब्जेक्टिव हबो ना सब्जेक्टिव हबो ringing or buzzing in the ear that is tinnitus na ringing in the ear perceived by the patient and ki कहबो described by the patients patient ही describe करबो कि ringing होची मारो कि buzzing होची in my ear बोलिकरी है ना it cannot be objectively measured or heard by an examiner so आमे देखि पारिबानी ना आमे जानि पारिबानी that is not a objective symptoms subjective symptoms about beta option A is the correct answer right next questions the most frequently occurring type of brain tumor is option A meningioma option B is glioma option C is pituitary adenoma option D is neurofibroma so which option is the correct answer which option is the correct answer which option is the correct answer so correct answer is glioma right most frequently occurring type of brain tumor is glioma tumors originating from glial cells tumor originating from glial cells from glial cell glioma right and this is the most common brain malignancy in adult patients in adult right next questions one of the most important lifestyle change to reduce the risk of cancer is option A decrease fat intake option B avoid smoking option C avoid exposure to sunlight option D adequate rest and avoid stress so which option is the correct answer so correct answer is avoid smoking right one of the most important lifestyle change to reduce the risk of cancer that is avoid smoking right option B is the correct answer next questions which of the following type of cancer has the poorest prognosis option A malignant melanoma option B sebaceous cyst option C glioma option D basal cell epithelioloma so which option is the correct answer so correct answer is malignant melanoma malignant melanoma melanoma malignant melanoma or skin cancer this is the skin cancer has the poorest prognosis right malignant melanoma so option A is the correct answer next questions plaster of Paris is the most commonly used material for immobilizations of fracture chemically the plaster of Paris is कौन chemical था बेटा plaster of Paris रे option रे calcium carbonate option रे calcium sulfate option C रे calcium hydroxide option रे calcium phosphate calcium phosphate calcium sulfate calcium carbonate calcium hydroxide so which option is the correct answer कौन था बेटा plaster of Paris रे POP रे कौन था calcium sulfate था calcium sulfate hemihydrate right calcium sulfate था बेटा option B is the correct answer calcium sulfate था plaster of Paris रे next questions what is the most important aspect of management of burn injury in the first 24 hours option A is fluid resuscitation option B is dressing option C is sterotomy option D is antibiotic administration so which option is the correct answer which option is the correct answer beta which option is the correct answer fluid resuscitation sterotomy is a surgical procedure बेटा जानता है this is a surgical procedure right in which deep incision is made through the rigid or lethargy burn skin right deep incision देके तब कौन करा जाए बेटा बर्न स्कार को रिमूव करा होछि। So which option is the correct answer? So correct answer is fluid resuscitation na. कौन हबो? Fluid resuscitation is the correct answer, right? Option A is the correct answer. Next questions beta. Which of the following is the commonest symptoms of foreign body in the respiratory passage of child? Which of the following is the commonest symptoms of foreign body in the respiratory passage of child? Option is vomiting, option is cough, option is wheezing, option is cyanosis. So which option is the correct answer? So correct answer is cough. Cough होगा ना बेटा? Cough is the commonest symptoms of foreign body in the respiratory passage of child. हाँ ना नहीं? So option B is the correct answer. Next questions. Which of the following are the first incisor to erupt in an infant? Which of the following are the first incisor to erupt in an infant? Option A रची बेटा upper central, option B रची lower central, option C रची upper lateral, option रची lower lateral. So which option is the correct answer? So lower central incisor. Option B is the correct answer. This is the first primary teeth to erupt in an infant around 6 months. Around 6 months. Around 6 months erupt hochi in infant. Lower central incisors teeth to erupt in infant around 6 months of age. Around 6 months of age. Next questions. Headache, vomiting, vertigo, diplopia, and skin desquamations are feature of acute hypervitaminosis with option A रचे vitamin A, option B रचे vitamin B, option C रचे vitamin C, and option D रचे vitamin D. So which option is the correct answer? So correct answer is beta option A, vitamin A, vitamin A. So headache, vomiting, vertigo, diplopia, skin desquamations are features of acute hypervitaminosis with vitamin A, right? Vitamin A जोगों होच hypervitamin acute hypervitaminosis एक का just sign increased intracranial pressures, headache, vertigo, visual changes that is diplopia, and desquamations that is peeling skin को हमें desquamations को होचे बेटा peeling skin को desquamations को होचे peeling skin, right? Next questions. In the following, which is the most common opportunistic infections in AIDS? आमे पढ़ी थिले बेटा किछि समय पूर्वरु. Option A रचे cryptococcosis, option B रचे histoplasmosis, option C रचे tuberculosis, option D रचे pneumocystitis carinii. So pneumocystitis carinii is the correct answer na. Pneumocystitis carinii, PCP. Pneumocystitis carinii. Opportunistic infections affecting individuals with AIDS. So option D is the correct answer. Option D haba beta. Option D is the correct answer. Question number 100. If glaucoma is left untreated, it leads to option A conjunctivitis, option B trachoma, option C retrolental fibroplasia, and option D blindness. So which option is the correct answer? Which option is the correct answer? If glaucoma is left or untreated, it leads to conjunctivitis, option A conjunctivitis, option B trachoma, option C retrolental fibroplasia, option D blindness. So which option is the correct answer? So correct answer is blindness. So blindness is बेटा जदि glaucoma को आमे छाड़ी देबा कि ट्रीटेड करबानी, right? ओके, थैंक यू सो मच बेटा. जो मैंने चैनल को सब्सक्राइब करना चैनल को सब्सक्राइब कर दिया और जो मैंने ए पर्यंत वीडियो को लाइक करना लाइक करके शेयर कर दिया, राइट? एंड थैंक यू सो मच बेटा. ओके नेक्स्ट सेशन नवा जदि बेटा 8 रे नवा हैला 8 बेले पुणी जॉइन हे जिवो मु एबे एएनएम मानक पय क्लासेस नउची देन 8 पीएम रे जॉइन हे जिवो समस्त राइट 8 पीएम रे जॉइन हे जिवो 8 पीएम रे पुणी थरे क्लासेस करबा बाकी त क्वेश्चंस मेडिकल सर्जिकल नर्सिंग राइट यस ग्रुप अच्छी व्हाट्सएप ग्रुप बेटा डिस्क्रिप्शन रे लिंक अच्छी लिंक रे जॉइन हे परिबो डिस्क्रिप्शन रे लिंक अच्छी देखि व्हाट्सएप ग्रुप अच्छी बेटा जॉइन हो पार फिर भी मुझे शेयर कर दूसरी टेलीग्राम टेलीग्राम ग्रुप एंड व्हाट्सएप ग्रुप मुझे शेयर कर दूसरी जॉइन हो राइट जो मैंने जॉइन हो न जॉइन हो लिंक माध्यम दे दूसरी लिंक जो मैंने पर्यंत जॉइन होना लिंक माध्यम जॉइन हो व्हाट्सएप लिंक एंड टेलीग्राम लिंक रे भी जॉइन हो राइट टेलीग्राम लिंक रे भी जॉइन हो जाओ ओके थैंक यू सो मच टू वन एंड ऑल एंड जो मैंने पर्यटन चैनल को सब्सक्राइब करना बेटा चैनल को सब्सक्राइब कर दियो वीडियो को लाइक कर दियो और शेयर कर दियो निज निज सांग मान पाखे जमी पहुंची पार ओके थैंक यू सो मच गॉड ब्लेस यू टू ऑल पुणे देखा बेटा 8 PM रे ओके से पर्यटन टेक केयर एंड बाय बाय